Birmingham Healthcare Trust is an organisation which delivers community-based healthcare within Greater Birmingham. By scale, we're actually one of the larger healthcare organisations in the local health economy. We deliver a wide range of services, ranging from your average things like district nursing, school nursing, but including things like community dietetics, children's services as well. So if you imagine everything that doesn't take place within a hospital setting or a GP practice, then by and large Birmingham Community Healthcare will be doing that within Birmingham. The challenge is one of huge system scale. Now with that comes if you like, the nice problem that we have is more data than we know what to do with. And what we're trying to do is to find ways of dealing with that data differently, presenting it differently, simplifying it, and in particular visualizing it differently in a way that supports local decision making within the Birmingham health economy. And we see that challenge as one as being a partnership. So as I mentioned before, we're working very closely with the council, working very closely with large third sector organisations, so think of the big charities and volunteer groups that are active in Birmingham. And we recognise that in order to get to where we need to get to in terms of using this data differently, it's got to be a collaborative process. What we're trying to do with the data is to come up with ways of describing people in community settings in a way that facilitates decision making for those people, specifically in relation to large-scale redesign and future use and impact and evaluation of public services for those target groups. So that immediately opens up our minds and our expectations to what's out there, what's new, what's interesting in terms of how we could look at this problem differently. And we recognise that just because we are focused on the health and well-being outcomes for people in Birmingham, it doesn't limit us to looking at health and well-being organisations or services, because immediately you start thinking about those challenges, you realise that you're looking at things like their housing needs, their educational needs, access to green spaces, the ability of people to feel safe in their neighbourhoods and on their streets and in their homes, for those streets to be clean and accommodating. So we recognise straight away that there's a wider set of issues for which we need to have access to data and data models to help us decide how best to come up with interventions that give us the outcomes that we want. And we sense that some of those creative inputs will best come from areas that ought to be surprising to us. So not necessarily healthcare public service, but anywhere where there's a creative energy and a creative instinct, and people have that willingness and courage to be innovative, we think they're going to be a good contribution to our challenge. We don't want to see what I call, here's one I made earlier, here's an answer that we figured out 10 years ago and we think it's a world beater. I'd say be collaborative, be courageous. Don't be afraid about rocking the boat a little bit. We want to be disruptive in the nicest possible way.